While the idea of a drain can seem quite intimidating, they're actually very simple to use and easy to take care of. A drain is placed for control of postoperative swelling and also to assist in the healing of the surgical wound. Drains are usually in for 7 to 10 days, but we will make a determination as to whether your drain should be removed based on the output of the drain at your first postoperative visit. A drain has 3 parts, but what you'll see will be this clear tubing that is connected to this bulb that actually will contain the fluid. The tubing will be secured to the skin, so you don't have to worry about it being pulled out, but we want you to be careful not to put too much tension on it. The bulb will create the vacuum, and it will have numbers on the side that will allow you to determine the volume of fluid that's inside, and you will be removing the cap from on top of the fill port, and look at the side of the drain where you see these numbers and record the volume out of the drain on the drain sheet that we provide to you. The drain should usually be emptied about every 4 to 6 hours while you have the drain in place. This allows us to make sure that you are having appropriate function of the drain and will help us determine if it's appropriate to have your drain removed at your first post-op visit. After you have emptied the bulb, you would want to then compress it as tightly as you can and then replace the stopper back on the top of the bulb. This will allow the vacuum to be restored and once again pull the fluid out through the tube into the bulb. Please be assured that nothing can get back into the tube, as there is a one-way valve that is built into the bulb so that we can protect you from anything that gets back into the tube after it is emptied. This will allow the suction to once again pull the fluid out through the tube into this bulb. If it appears that there is anything stuck in the tube itself, you can perform a maneuver we call stripping the tube. You will grab the tube about 3 inches away from the body. You want to pinch it very tightly between your finger and thumb, and then take the finger and thumb of the opposite hand, squeeze the tube, and draw it away from the hand that's holding it firmly. You then release this hand and allow the extra vacuum to dislodge anything that is in the tube. Performing that maneuver a couple of times a day is probably sufficient. If you're having trouble with that, we ask that you call the office to let us walk you through the procedure and make sure that you are comfortable with the care of the drain. Your drain will be removed probably at your first post-op visit. The procedure requires cutting the suture and gently sliding the drain out. It is very well tolerated, and we do not usually request that you take any medication prior to coming to the office. After the drain is removed, we will give you dressings to apply for the next day or so, but it's quite easy to have the drain removed in the office. We are here to help you take care of your drain, and if you have concerns, we would love to have you call the office. Some of the things to watch for would be a sudden increase or decrease in the volume of your drain output, or redness that would occur around the skin that's located adjacent to where the drain exits the skin. Please feel free to contact us at any time if you have any questions regarding your drain or its function.